Hi, I'm Douglas Joyce, the founder and owner of the Joyce Vein and Aesthetic Institute. We are a state-of-the-art venous treatment center located in Punta Gorda, Florida. When you have back pressure in the venous system due to the valves not functioning correctly, the pressure in the veins will begin to rise, and this is known as venous hypertension. What venous hypertension means is, just like hypertension, which is arterial, which is high blood pressure in the veins causes the veins to go through the transformations that cause venous disease. In other words, they swell, enlarge, begin to leak fluid, and eventually that hypertension is so high and that pressure in the veins is so high that the blood cannot flow forward the way that it should. And when that happens, then the blood stops flowing forward in an area, then the tissue in that area is compromised. It cannot be oxygenated, it cannot receive nutrition, and it cannot get rid of its wastes. And that leads to changes that are known as venous stasis changes. In other words, you start seeing major changes in the skin in that area. Discoloration will occur, thickening will occur, and eventually ulceration will occur, which is the most serious type of venous disease. The techniques we use at JVAI, as I mentioned, are state-of-the-art techniques. We're constantly improving them. But many physicians that are treating veins nationwide are still using what we would consider obsolete techniques. To give you an example, last summer I had a 26-year-old woman come from one of the big hospitals in Boston, and she had had formal vein stripping on her leg. And this very attractive woman had scars all over her leg. She was now moving to Florida and sought care with us. I was able to do the equivalent of what they had done in Boston on her other leg through 3 needle sticks like that. And she couldn't believe the difference. You couldn't even find the marks. It looked like 3 extra freckles on her leg. The other leg looked like someone had gotten a hold of it in a major surgery center. Most of the techniques that we use at JVAI were developed at JVAI. We were pioneers in the original laser venous surgery. Back in the year 2000, 2001, when laser ablation of varicose veins was an experimental procedure, we were one of the few centers that had a laser system, and were using that on patients to try to determine what the proper use was to achieve excellent results with laser ablation. After the first few laser ablations, it became apparent that this would replace venous stripping. There was no comparison in patient comfort or in post-op pain to the two procedures. But it was a matter of years to develop the perfect technique to do it. And we have, we've developed a perfect technique for venous laser ablation. We perform it every day. We perform sometimes 50 cases in a week. And patients do excellently. They're in and out of the operating room within 15 to 20 minutes. They have an excellent surgical result. And we're generally extremely happy with our present way of doing this, which has evolved over the past 14 years. The techniques we use for venous surgery can be divided into 2 types. One is the laser ablation of saphenous veins. This is a technique which we pioneered back in the early 2000s, which is now the mainstay. It has been taught to multiple physicians over the years that have come here for training, and has spread from this center and other centers, and is pretty much done with minor modifications the same way by people who are experienced in venous disease. The second technique we use is for the closure of perforator disease, and we use a laser single needle closure, which really was developed at JVAI and is just now starting to make it into other medical practices. Physicians have come here over the past year and have been trained in this, and it is now starting to move into their practices. So my hope is that this technique will be the state-of-the-art, or the actual accepted way to treat perforator disease, because in our mind, after doing over 3,000 of these, we're convinced that this is the absolute way that venous disease of perforator should be treated. Some of the first patients that we were able to treat perforators on with severe leg ulcers, we used the SEPS operation, which was brand new at that time. And one of the patients was actually a gentleman who was a linebacker for Vince Lombardi on the Green Bay Packers, and he had horrendous legs. And most of that was due to trauma, which can cause venous disease. And we were able to take him in and do a sepsis operation on him, and this thick, crusting, ulcerative areas on his legs healed up right away, within months. And that was the type of patient that made a believer out of us in the beginning in regard to perforator disease. Another patient had ulcers so severe that she was wheelchair bound on both legs, and she came in for the sepsis operation, but she had been taking aspirin. So I advised her that we really needed to send her home, and she would get off the aspirin and then we'd bring her back and do it. Her husband met with me and said that he was scared to send her home because she was talking about committing suicide. And she was very religious, and she had been praying that she wouldn't go to hell if she committed suicide. And she was dead serious about doing that. And he was afraid that if we sent her home, that she'd pull it off when he wasn't watching. And so we took her to surgery, and we did the surgery on her. Both of her ulcers healed. She got out of the wheelchair and obviously did not commit suicide. It changed her life. So those are the cases that proved to me very early on that closing perforator veins that were incompetent could significantly impact a patient's life, and this was worth looking at. To make an appointment, you're welcome to call our toll-free number, which is 866-998-1312, or visit the Venous section of our website, www.jvai.com.